There are four types of cranial bone motion. There's the primary respiratory motion, secondary respiratory motion. There's the cranial bone sutural motion as well. And then, of course, there's the duromeningeal influences. So there's four types of motion in that. And then we also have, as we said, the sutural mobility. So for this particular class, I'm going to talk mainly about secondary respiratory motion and effects on the dura and the movement of the cranial bones. Now, one of the things we do know about in the pediatric practice is that the infant is breathing 30 to 80 times per minute, and it's really hard to be able to control, of course, their breath, their in-breath and out-breath. But given that said, we're also talking about the cranium expanding, contracting at that time, and we can also use our dorsal and plantar flexion to facilitate those flexion extension stages. Now, the importance about understanding flexion, extension, internal, external rotation is really so we have a common language. So when we talk about making specific cranial bone corrections, we can talk about what direction to make them in. So when we're dealing with specific cranial bone corrections, the occiput, temporal, frontal, parietal, maxilla, all those bones, then we say to people, oh, we're adjusting the temporal external rotation or internal rotation. There's a way that we can actually have a language that we can communicate with each other across the board so that we understand what's happening. So what I'm going to do is I'm going to talk a little bit about those types of motion. And whenever we talk about inhalation, we talk about two things occurring in the cranium, flexion and external rotation. What that means is the bones like the occiput and will go into flexion and extension, and then the bones like the temporal will go into internal external rotation. So we're not talking about the bones only moving in that direction. What we're really talking about is the global effect that inhalation and exhalation has on it. And when I mention that global effect, what we're really talking about is every time you breathe in, the cranium will expand laterally and it closes up A to P. So when you breathe in, it expands like this. When you breathe out, it comes back together. The same thing happens throughout the body. Every time you breathe in, that's what we call secondary respiratory motion bilateral. Every time you breathe in, your diaphragm drops, your lungs expand, your rib cage expands. When you breathe out, it collapses. That happens throughout your entire body. Every time you breathe in and breathe out, there's a bilateral mechanism that occurs. For the cranium, when you breathe out, the cranial bones then go into what we call extension and internal rotation. Now, the main pivot point when we talk about flexion extension is going to be the spheno-basilar. And so when we talk about the system going into flexion, this is a respiratory inhalation and exhalation. So here's our spheno-basilar angle. You can see when you breathe in, the spheno-basilar angle rises. When it rises, it gets smaller. That is where flexion comes from. When it drops, when you breathe out, it goes into extension. All the other bones, of course, relate to the synchondrosis joint and its movement. So we talk about the occiput. And remember, the occiput is a membranous bone, so it can flex literally upon itself. So when we're talking about flexion, we're talking about the basilar portion of the occiput coming up, and we're also talking about the squamosal portion approximating the frontal bone. All right. And then when we talk about the frontal, even though it's going into flexion and extension, it is doing that, the squamosal portion. What we're talking about when we make adjustments to the frontal is this angle here, the zygomatic frontal angle. So that is the angle that we're referring to. So when we look straight on, you'll see in a minute at the cranium, that lateral angle expands on inhalation or goes into external rotation.